I will now demonstrate the origin, insertion, and the actions of all the muscles in the hip girdle. First, we're going to start with the muscles on the anterior side with the iliopsoas. This originates on the lower border of the transverse process, the sides of the thoracic vertebrae, as well as the intervertebral fibrocartilage and the base of the sacrum. It inserts on the lesser trochanter and pectineal line and the iliopectineal eminence. The action is flexion of the hip, anterior pelvic rotation, external rotation of the hip, as well as transverse pelvic rotation to the ipsilateral side and lateral pelvic rotation to the contralateral side. Next, we're going to move to the rectus femoris, which originates on the superior iliac spine and groove above the acetabulum, inserts on the superior aspect of the patella and patellar tendon to the tibial tuberosity. Action occurs is flexion, extension of the knee, and anterior pelvic rotation. Next, the sartorius originates on the anterior superior iliac spine and notch just below the spine, inserts on the anterior medial surface of the tibia just below the condyle, and action is flexion of the hip, anterior pelvic rotation, external rotation of the thigh, and abduction of the hip. Next, the pectineus originates on the space 1 inch below in front of the pubis, just below the crest. Insertion is the rough line leading from the lesser trochanter down to the linea aspera. And the action is flexion, adduction of the hip, and external rotation of the hip. Now we're going to move to the muscles of the medial side. First, starting with the adductor brevis, which inserts on the front of the inferior pubis ramus, inserts on the lower 2/3 of the pectineal line of the femur and the upper half of the medial lip of the linea aspera. The action is adduction of the hip, external rotation as it adducts the hip, and assists in flexion. Next, the adductor longus originates on the anterior pubis just below the crest, inserts on the middle 1/3 of the linea aspera, and the action is adduction as well as assists in flexion. Next, the adductor magnus originates on the edge of the entire pubis ramus and ischium and ischial tuberosity, inserts on the whole length of the linea aspera and the intercondylar ridge and adductor tubercle. The action is adduction and external rotation of the hip as it adducts, as well as extension. Next, the gracilis originates on the anterior medial edge of the descending ramus of the pubis. Insertion is the anterior medial surface of the tibia below the condyle, and the action is adduction of the hip, as well as assists in flexion of the hip and internal rotation. Next, we're going to move on to the muscles of the posterior side, starting with the semitendinosus, which originates on the ischial tuberosity, inserts on the anterior medial surface of the tibia below the condyle, and its action is extension, posterior pelvic rotation, and internal rotation. Next, the semimembranosus also originates on the ischial tuberosity. Inserts on the posterolateral medial surface of the medial tibial condyle. Action is extension of the hip, posterior pelvic rotation, and internal rotation. Next, the biceps femoris. The long head originates on the ischial tuberosity, the short head on the lower half of the linea aspera and lateral condylar ridge, and inserts on the head of the fibula and lateral condyle of the tibia. Its action is extension of the hip, posterior pelvic rotation, and external rotation. Next is the gluteus maximus, which originates on the posterior fourth of the crest of the ilium, posterior surface of the sacrum and coccyx near the ilium, and fascia of the lumbar area. It inserts on the oblique ridge of the lateral surface of the greater trochanter in the IT band of the fascia latae. Action is extension of the hip, posterior pelvic rotation, external rotation, and the upper fibers assist with hip abduction, and the lower fibers assist with hip adduction. Next, we're going to move to the muscles of the lateral side, such as the gluteus medius. This originates on the lateral surface of the ilium just below the crest, inserts on the posterior and medial surface of the greater trochanter of the femur. Its actions are abduction of the hip, lateral pelvic rotation to the ipsilateral side. Its anterior fibers assist with internal rotation, anterior pelvic rotation, and flexion of the hip, whereas the posterior fibers assist with external rotation, extension, and posterior pelvic rotation. The gluteus minimus originates on the lateral surface of the ilium, inserts on the anterior surface of the greater trochanter. Its action is hip abduction, lateral pelvic rotation of the ipsilateral side, hip internal rotation as the femur is abducted, flexion, and anterior pelvic rotation. Finally, the tensor fasciae latae originates on the anterior crest and surface of the ilium just below the crest, inserts on fourth of the way down the thigh into the IT tract, which it turns into the Gerdes tubercle of the anterior lateral tibial condyle. Its actions is hip abduction, lateral pelvic rotation of the ipsilateral side, flexion, anterior pelvic rotation, and internal rotation of the hip as the hip is flexed. Boom.